Pediatrics of Nursing by Allison Mann, Elena Jones, Kiana Johnson, Tanya Kolodich, and Caitlin Kostick. The National Association of Pediatric Nurse Practitioners was founded in 1973. It was considered a nonprofit specialty nursing organization dedicated to improving the quality of infant and child care. The NAP provides advanced care for infants, children, and adolescents up to age 17 to 18. The definition of pediatrics is a branch of medicine dealing with children and their diseases. Families cared for their children using folk medicine. Only the wealthy had physicians. The event that marks the beginning of the specialty of pediatric nursing was the Children's Hospital, founded in 1855. The 1980s is when the push toward family-centered care began. Surgeon General C. Everett Koop's report on children with healthcare needs spurred family-centered care.
Nursing diploma. This can take up to 2 to 3 years. Students take anatomy, physiology, and child psychology in addition to working with healthcare professionals to learn nursing skills. Associate's and bachelor's degrees. These programs take 2 years for associates and 4 years for bachelor's. You must take classroom courses along with participating in clinical hours. If you are certain you want to specialize in pediatrics, some programs have specific courses you can take as well. All nurses must be registered and licensed. You must take the NCLEX RN exam in order to become an RN. This exam makes sure you know fundamental skills of nursing and can provide excellent care in your workplace. Some states have other or more requirements, so you must know the criteria for your state. Having a master's degree allows you to focus on a specific area. To be an applicant, you must have one of the three: BSN, register in a 4-year BSN program, or having a diploma or associate's degree and enter a bridge program.
Pediatric nurses administer medication. They provide routine medical care to children and infants. Their typical duties are inserting catheters, taking vital signs, and assisting families to cope with a child diagnosed with disease or illnesses.
Nurses who specialize and devote their knowledge and skills to caring for children from infancy through the late teen years and their families. Like other nurses, pediatric nurses can perform physical examinations, measure vital statistics, take blood and urine samples, and order diagnostic tests. Nurses with advanced training can interpret test results to form a diagnosis and to help develop treatment plans for the patient. Pediatric nurses know how to talk to children and how to dispel their fears. They also know how to ask children questions about their health so they can gather complete and accurate information to aid in diagnosis and treatment. Pediatric nurses often assist doctors by providing medical care and information about diseases and treatment plans to their young patients. They can be found working in hospitals, clinics, and private practices, depending on each patient's particular treatment plan. Pediatric nurses' job duties may include administering medications, placing IV lines on patients, and administering other kinds of therapy.
Pediatric nurses work in doctor's offices, clinics, hospitals, surgical centers, and other healthcare settings. Their skills bring particular comfort to parents and children being treated in acute care departments such as the neonatal unit, pediatric critical care unit, and the pediatric oncology ward. Pediatric nurses also work in schools, in private practice, and for community groups and other organizations that provide outpatient and preventative health care services for children, including children who have limited access to health care. Pediatric nurses earn $48,000 to $68,000 a year, although compensation depends on your level of education, experience, geographic location, and the type of facility where you work. Experienced pediatric nurses can earn $100,000 a year or more.
The issue of child welfare is important to pediatric nurses and to the health care of children. The definition of child welfare is simply the issues related to children faring well in a nation, a society, or throughout the world. Basically, it is the concern of a child's well-being and the protection from harm. The efforts of the Society of Pediatric Nurses with regard to child welfare are rooted in the need to make children and children's health a national priority. Children may be vulnerable for a variety of reasons and need the advocacy of adults in order to grow and thrive. The pediatric nurse is in the key position to identify the needs of children, assess children's vulnerabilities, advocate for their rights, and ensure public protection.